With coronary artery bypass surgery, we actually get blood flow directly to the heart muscles by bypassing the obstruction on those coronary arteries. And it's done with a portion of vein taken from your leg, and also with it's called the left internal mammary artery, which is a vessel that runs on the inside of the chest wall. And it actually arises from this vessel here called the left subclavian artery, which provides blood flow to the arm. What we do is we leave it attached, right? This is a representation of the origin of the left internal mammary artery. We leave it attached here, and then we separate it from the chest wall with special instruments. We tie off what's called the distal end, then we swing it over, and we actually sew it directly to this left anterior descending. That is really the gold standard for coronary bypass surgery. It's associated with the highest patient survival, and it's really the blood vessel you really want on your heart, because that really determines how well you're going to do long term. The vein is usually used to bypass the lateral portion of the heart, the circumflex, or the right side, the right coronary artery. And one end of the vein is placed there. The other end of the vein is placed onto your ascending aorta, which is a big blood vessel coming off your heart. So at that point, the heart pumps, blood comes out of your ventricle to your aorta, through the vein, into the artery beyond the point where it was narrowed. That's why it's called a bypass operation.